Hey dear students, I hope you are doing good. We will learn about the types of injury, that too bruise or contusion. We have discussed about the abrasion. I hope you have liked the lecture as well. Now to begin with, we have this definition of bruise. What are bruises? This bruise mostly occurs when a rupture is observed in the blood vessels that can mostly be capillary when they come in contact with blunt force, and often this pressure leads to the extravasation of blood. Now what is extravasation? Leakage of blood. This leakage of blood takes place in the subcutaneous or epithelial tissue. So this is the subcutaneous tissue. These are the layers of your skin. I hope you have learnt about it while reading the anatomy of skin. Okay, this bruise is derived as name from brisand, that means to crush. So basically a crushing force is applied that leads to the cause of bruises. Now we mostly use this bruise and contusion words interchangeably, but there is a slight difference between them. A bruise is a lesion that is observed in the overlying skin. Okay, that could be some purple discoloration. This is how a bruise looks like. It has happened on the skin's uppermost layer. This is the bruise, and a bluish purple color is observed. There can be slight pain or swelling in these areas as well, but the contusion is a bruise. Contusion is a bruise as well. The only difference is it is caused on the organ or tissue, be it your muscle, be it your liver, or any other viscera as such. There is no loss of continuity in the overlying skin. As you can see in this diagram, do you see any kind of disturbances in the continuity of skin? No, not. There is nothing as such like happens in the case of other types of injury, like in abrasion. There is disturbance in the continuity of skin. Of course there are some scratches, so the continuity of the skin has been broken down. While in case of some puncture wound, in case of stabbing, there are lots and lots of disturbances that are caused in the continuity of skin, but nothing as such happens in the cases of bruises. Now this bruise can occur when the person is hit by someone by fist or by iron rod, cane, whip, or chain or something like that. Whip somewhat look like this, something like this. Okay, there is long thing, or hunter or anything of that sort. Now in case of compression by finger, a butterfly bruise is observed during the medical examination in order to check the consciousness of the person. Sometimes it also happens due to the pinching as well. Then we have this classification of bruise. Basically there are three classifications that we will be taking into consideration, that is intradermal bruise, subcutaneous, and the deep bruise. As the name suggests, intradermal bruise, it is caused in the subepidermal layer of the skin, mainly due to some patterned object. When they come in the contact of the skin, a pressure is caused and often leading to the intradermal bruise. Then subcutaneous, the subcutaneous tissue, the subcutaneous layer, mostly the fatty portion of the skin is mostly what gets affected in the case of this bruise. Here you can have a look. This is the subcutaneous layer of the skin, the fatty layer, the tissue containing layer of the fatty tissue containing layer of the skin. It is the most common type of the bruise, and it is mostly caused by the blunt object. Now how you are going to identify this bruise? By the presence of dark red swelling. Fine. Deep bruise, as the name suggests, bleeding deeper is what the significance of this bruise is. It occurs and mostly in the subcutaneous layer as well. It will take 1 to 2 hours to appear. Hence, it is also termed as delayed bruising. Why? Because it takes longer time than any of the other these two types of bruise to appear. In order to carry out the examination of this type of bruise, we mostly use IR photography, infrared photography. Now let us discuss about different factors that are responsible for causing the bruise. First of all, the sites, the tissue which is involved in causing the which is affected by the bruise is most important in order to determine the nature of bruise, because you cannot expect that every person will be bruised in same manner, or every different races will be bruised in same manner. No, it might not be the case. First of all, and the scrotum, the eyelids are more prone to getting bruised even with a small force. Why? Because the portion present there is soft, whereas the vascular tissues are also highly present in that area. Okay, now the other portion of abdomen, your scalp, palm, soles are also prone to get bruised even in the case of moderate violence. Why? Because they contain lots of fibrous tissue in that area, which is covered by the thick dermis. Then scalp, in your scalp if bruise is present, then it will be felt more than seen. Why? Because your scalp is covered with lots and lots of hair, so it is impossible to see bruise caused there. And the tissue which are overlying the bone are also prone to getting bruises. Athletes and boxers are less prone to getting bruised because they have an excellent muscle tone. Then alcoholics who have cirrhosis, liver cirrhosis, and people who take aspirin are more often prone to get bruised. children and elder people are more prone to get bruised. Why? Because their skin is delicate, their skin is extremely soft. You could have seen that old people have this loose skin tissues, isn't it? So, delicate skin and loss of subcutaneous supportive tissue. In case of old people, kids have delicate skin and old people have lost the subcutaneous supportive tissue, followed by the cardiovascular changes that happen in the older people. Then we have this sex. Women bruise more easily than men. Why? Because men have less delicate tissue as compared to that of the women, whereas the people who are obese, they also bruise more easily as compared to the people who are lean. Color of the skin. In fair people, bruise is easily seen as compared to the people with darker skin tone. Then there are some natural diseases like scurvy, hemophilia, atherosclerosis, purpura hemorrhagica, leukemia, vitamin K deficiency, phosphorus poisoning, bleeding diathesis. These are all the cases where people can suffer from bruise even via minor trauma. Okay. Then we have this age of bruising, the way we deal with age of abrasion. First of all, red oxygenated blood is present. What happens in the case of bruising? The extravagation of blood, leakage of blood happens. So in case of fresh bruise, color would be red, and most often people apply ice in this condition in order to avoid bruising. After a few hours or 3 days, blue color would be observed. This blood is oxygenated, but the color of blood turns blue. Why? Because now it is deoxyhemoglobin. This blood is deoxygenated. After 4 to 5 days, bluish to brown color, bluish black or brown color would be observed. This is due to hemosiderin. Then green color of biliverdin in 5 to 6 days. 7 to 12 days means approximately 1 week. Yellow bilirubin. Yellow color would be observed, which is due to bilirubin. Then finally in 2 weeks things would get back to normal. Okay. This table is very important. Do remember the colors and also the days very carefully. Questions could be asked from this table. Okay. We are dealing with the forensic medicine. So forensic aspect, the medical legal aspect would be definitely taken into consideration. It is advisable that medical officer, in case you are the medical officer, please try to re-examine the patient after 24 hours, because there might be chances that some delayed bruises could be there, which might not be visible very immediately during the examination and can appear after a while. Then age of injury can be determined as the color changes proceed. Look here, by seeing the, in case you find that green color bruise is there, so you might assume that 5 to 6 days must have passed past injury. Then degree of violence can also be observed by observing the size of the bruise. Larger the bruise, larger the weapon would have used. See, larger the weapon would have used and more force must have applied. These all things can be determined. Then nature of injury would also be figured out. Apart from this, contusions, the bruising of the internal organs, is what we call contusions. It would also be there in case of post-mortem. If the severe blow has been given to the body after few hours of death, it could be seen. And in order to figure it out, to figure those contusions out, some deep incisions are made in the suspected size, so you can easily see ecchymosis. Bruises are of less value than abrasions. Here are few reasons why. This question must be asked, might be possible. It could be asked in your viva. So do pay special attention to it. Why bruises are less important than abrasion? Because size of bruise might not be corresponding to the size of the weapon that is used. In case of aberration, size of weapon or the surface that is responsible for causing it can be easily figured out, but bruises are not very well with it. They do not indicate the direction of force, as there will be simple bruise like this, some blue colored thing. You might not be able to figure out what was the direction of force at which the bruise must have caused. But in case of abrasion, you can easily figure out by saying this grazes, here. It clear cut represent the direction of the weapon or whatsoever that have caused it. And bruise may become visible after a few hours or even 1 to 2 days after the injury. So this delay in the time span can also be the major lacuna why it is not taken into consideration most of the time. They may appear at distance away from the actual site of the injury. Ectopic bruises. Ectopic nature of bruises. Okay. So this is also the quite confusing thing, because you may not be able to know the exact location where the injury would have caused. Here, look at the stages of bruises in the pictorial form. Reddish color, then followed by purple, bluish, and finally yellow color, which was due to the presence of bilirubin. Have a look. This 7 to 12 days. So in case you observe yellow color in the bruise, it means it is approximately 1 week older bruise. Fine. I hope the lecture is clear to you. Thank you so much.